Greetings and welcome to Wally's nursing videos. Today we will be discussing postpartum care to include breastfeeding and postpartum complications, physiology of the postpartum period, uterine involution. After childbirth, the uterus undergoes a process called involution, where it gradually returns to its pre-pregnancy size and shape. Involution is facilitated by contractions of the uterine muscles, which help expel lochia, postpartum discharge, and reduce the risk of postpartum hemorrhage. Breastfeeding initiation, hormonal changes, particularly the release of prolactin and oxytocin, stimulate milk production and the letdown reflex, enabling the mother to breastfeed her newborn. Breastfeeding provides essential nutrients and antibodies for the baby's growth and immunity. Hormonal adjustments. Following childbirth, hormonal levels fluctuate as the body adjusts to the cessation of pregnancy hormones such as estrogen and progesterone. These hormonal shifts can contribute to mood changes known as the baby blues, which are common in the early postpartum period. Maternal bonding and adaptation. The postpartum period is a critical time for maternal bonding and adjustment to parenthood. Mothers may experience a range of emotions, from joy and fulfillment to anxiety and exhaustion as they navigate the challenges and rewards of caring for their newborn. Nursing care during the postpartum period. Maternal and neonatal health monitoring. Nurses monitor vital signs, assess uterine involution, evaluate lochia characteristics, and check for signs of complications such as postpartum hemorrhage, infection, or thromboembolism. Neonatal assessments include monitoring vital signs, feeding patterns, and signs of jaundice or other health concerns. Breastfeeding. Support, pain relief for breastfeeding. Nipple pain. Nipple pain is a common issue experienced by breastfeeding mothers, often due to improper latch, engorgement, or nipple trauma. Nurses can offer several strategies to alleviate nipple pain. Correcting latch. Nurses educate mothers on achieving a deep latch to ensure proper milk transfer and reduce nipple pain. Techniques such as ensuring the baby's mouth covers both the areola and nipple can help prevent nipple damage. Breastfeeding positions. Exploring different breastfeeding positions such as the cradle hold, football hold, or side-lying position can help mothers find a comfortable and effective feeding position that minimizes nipple pain. Warm compresses. Applying warm compresses to the breasts before breastfeeding can help relieve engorgement and promote milk flow, reducing discomfort during nursing sessions. Cabbage leaves. Some mothers find relief from engorgement-related pain by applying chilled cabbage leaves to their breasts. Cabbage leaves have been traditionally used for their anti-inflammatory properties, which can help reduce swelling and discomfort. Mothers can wash and dry cabbage leaves, gently crush them to release their juices, and place them inside their bra against the breasts for about 20 minutes at a time. However, it's essential to monitor for any adverse reactions and discontinue use if irritation occurs. Breastfeeding support provided by nurses. Guidance on breastfeeding techniques. Nurses offer step-by-step guidance on breastfeeding techniques, emphasizing the importance of proper latch, positioning, and milk transfer. They demonstrate techniques such as hand expression or breast massage to help mothers initiate and maintain breastfeeding. Positioning and latch assistance. Nurses assist mothers in finding comfortable and effective breastfeeding positions and ensuring a deep latch to optimize milk transfer and prevent nipple pain or damage. They provide hands-on support and feedback to help mothers and babies establish successful breastfeeding routines. Management of common breastfeeding challenges. Nurses address common breastfeeding challenges such as engorgement, mastitis, plugged ducts, or nipple pain by providing tailored interventions and education. They may recommend techniques such as breast massage, warm compresses, or frequent nursing to alleviate discomfort and promote milk flow. Access to lactation consultants or support groups. Nurses facilitate access to additional breastfeeding support resources, such as lactation consultants, peer support groups, or online forums. They provide information on local lactation services, breastfeeding classes, and community support networks to empower mothers with the resources and support they need to navigate breastfeeding challenges successfully. Emotional support and encouragement. In addition to practical assistance, nurses offer emotional support and encouragement to breastfeeding mothers, acknowledging their efforts and providing reassurance during the early days of breastfeeding. They create a supportive environment where mothers feel comfortable asking questions, expressing concerns, and seeking guidance on breastfeeding-related issues. Postpartum complications assessment. Nurses assess for signs of postpartum complications, including excessive bleeding, hemorrhage, fever, abdominal pain, or signs of infection such as redness, warmth, or discharge from cesarean incisions or episiotomies. Education on newborn care and postpartum self-care. Nurses offer education on newborn care topics such as diapering, bathing, safe sleep practices, and recognizing signs of illness. They also provide guidance on postpartum self-care, including perineal care, wound care, if applicable, pain management, and nutrition. Discharge teaching. Before discharge, nurses provide comprehensive education to new parents to promote a smooth transition to home care. Infant care. Instructions on feeding, diapering, bathing, and temperature regulation to ensure the baby's health and well-being. Signs of postpartum depression. Education on recognizing the signs and symptoms of postpartum depression or anxiety and guidance on when to seek help from healthcare professionals. Contraception options. Discussion of contraception options to prevent unintended pregnancy and spacing of future pregnancies, including hormonal methods, barrier methods, and long-acting reversible contraception, LARC. When to seek medical assistance. Clear guidance on signs and symptoms that warrant immediate medical attention, such as severe pain, fever, excessive bleeding, or difficulty breathing. Complications of the postpartum period. Postpartum hemorrhage, excessive bleeding after childbirth, either due to uterine atony, failure of the uterus to contract, or retained placental fragments. Prompt intervention with uterotonic medications, uterine massage, or surgical procedures may be necessary to control bleeding. Puerperal infections, infections of the reproductive tract, including endometritis, uterine infection, wound infections, or urinary tract infections. Antibiotics and supportive care are essential for treating infections and preventing complications. Postpartum depression, a mood disorder characterized by persistent feelings of sadness, anxiety, or irritability following childbirth. Counseling, support groups, medication, or a combination of treatments may be recommended to manage postpartum depression and promote maternal well-being. Nurses play a pivotal role in providing comprehensive postpartum care, addressing physical and emotional needs, promoting maternal-infant bonding, and facilitating a smooth transition to parenthood. Through education, support, and vigilant monitoring for complications, nurses contribute to positive outcomes for mothers and newborns during the postpartum period.